Why might you be prescribed antidepressants?
Prolonged period of low mood, possible anxiety.
To regain that balance is important as an overall holistic approach.
That's why I always think medication helps alongside additional therapy.
What are different types of antidepressants? It's another commonly prescribed one, isn't it?
Fluoxetine, so
they're commonly prescribed, aren't they, because of their good safety profile?
Yeah. Let's look at the next questions. Okay, so what to expect from taking the antidepressant?
It depends on the individual. Some individuals will tolerate it better in the early stages. Others may take quite some time. So in some cases, some people may even feel a bit worse for the first 2 weeks, namely an increased incidence of anxiety, suicidal thoughts, agitation. Lots of people sometimes say, well, I'm feeling worse. Why have I been put on this? But just to remember that sometimes symptoms may increase in this phase, and to stay in touch with your prescriber, typically in the first 1 to 2 weeks, and report any unusual side effects or symptoms that may affect your quality of life within this time period. In the beginning, so when they initially start you off on a low dose, and they often will adjust that dose, and they will gradually increase this dose, and they will increase it depending on your level of tolerance, on the incidence of side effects. If you are feeling a bit unwell and the doctor tells you, well, this is a starting dose, and if you're still feeling unlike yourself and it is still affecting your quality of life, especially in those first 2 weeks, then it's important to keep that rapport with your GP, discuss it with them, keep reporting back to them if you need be, and they will adjust the starting dose as necessary.
It depends, again, down to the medical assessment, how long you're on medication as well, and which medication you're on, about the dose adjustments. It depends on tolerance, body weight. Sometimes you've got other medication to take in as well that may need to adjust your dose of medication.
And just following on from what you're saying, our physiology changes over time. So an overall change in health status will inevitably influence what you are taking in the way of antidepressants, and it may govern if you need to switch, or if you need to reduce a dose, or even come off it. Some people start taking new medicines. Another common one, and I get lots of these questions, is I'm taking supplements. I'm taking A, B, C. Does this go with my antidepressant? I've heard this works. Ashwagandha is one of them, or St. John's wort, which of course interacts with many things, which usually is less commonly recommended for that reason.
Really interesting point, Maria, because a lot of people would just think taking vitamins wouldn't really affect my medication. So they might not even mention it to the prescriber, and the prescriber might not even ask the question. So it's really important to tell them about other supplements, vitamins they're taking, the holistic approach, and let them decide if it's still okay to take.
This is why it's important. Again, we can't stress enough to discuss with the prescriber, to stay in touch with them, and to report any unusual symptoms, any new symptoms, to address that with the prescriber. Everybody's interested in side effects, especially when it comes to antidepressants. Lots of people are deterred by side effects. What we advise people to do is to always familiarize yourself with the patient information leaflet of your prescribed medicine, because side effects can vary depending on an individual and depending on the antidepressant. But to name a few: nausea, dizziness, insomnia, increased sweating, headaches.
Yeah, because some of the side effects, they're quite, they impact people's lives, don't they? So, if you're in a relationship, then, sexual dysfunction, then your mood's affected. So it's a knock-on effect, and it can affect you psychologically.
If you experience some more concerning side effects, then it's important to report back to your prescriber.
There is a solution to side effects. So we are talking about side effects, but it doesn't mean you have to put up with them. So you can, again, reach out to your GP. You can even go to your pharmacy.
So there are general tips and tricks to help you manage those common day-to-day side effects. So things that we don't like to carry during the day, and we know it's a side effect. So one of them is nausea, of course. So we advise people to take their medicine with or after food, because this is less likely to bring on the nausea or help you manage it. For headaches, we advise people to stay hydrated. They may not affect some people, they may affect others, but there are ways of handling them, managing these symptoms. It's never too trivial, it's never too little. Your GP wants to hear about it, your pharmacist wants to hear about it, and your counsellor wants to hear about it, so speak. And this is the way to hopefully reach a desired treatment outcome overall.